have with us Dr. Balavardhan Reddy, Senior Consultant Orthopedic Surgeon at Apollo Hospitals, Jubilee Hills, Hyderabad. Dr. Balavardhan Reddy is a renowned orthopedic surgeon in Hyderabad. He has 24 years of experience in medical field. His specialization is he is specialized in arthritis, knee replacement, joint replacement surgery, spine, shoulder, and hip surgeries, etc. Welcome, doctor, to our Facebook live session. Starting with our first question, what is the most frequent complication after a hip replacement surgery?
I think coming to the complication of hip replacement, I would say a few words about hip replacement. What is hip replacement? Why it is done? When it is done? And who all the which kind of patients it's done regularly. So the hip replacement is called total hip replacement, which is which is done for the patients with hip arthritis. Hip is a pelvic joint, where the pelvic girdle and the thigh bone joints. Thigh bone is called femur. Femur has got a neck on the upper end of the femur, the topmost part of the femur, which sits into a hip socket, which is called acetabular. So when patient for any reason gets arthritis of hip, which is seen in almost all age groups, from younger age to middle age and the old age people also. Nowadays, very commonly we are seeing hip arthritis because of COVID. COVID has done a lot of damage to our body. One of the part which is affected by COVID is also because of because of the viral load or whatever the patient's infection. Patient is being given antiviral medication and also steroids when there is less response for the antiviral medication. So which causes avascular necrosis of the femoral heads, which will in turn cause hip arthritis. So these are the common things which we are seeing in the younger age group nowadays. Otherwise, in pre-COVID era, the arthritis or avascular necrosis was seen only because of idiopathic causes, where the cause is unknown, and because of the alcoholic consumption or excessive alcohol intake. These are the two things which we used to see in the younger age group. Now, coming back to the hip replacement, it's got its own limitations and permutations, but it is a boon for the patient who has got a lot of pain in the hip. When he walks with a lot of pain, with antalgic gait, is not able to do his daily rituals, his functions, then that's where you really need to replace his hip joint. Hip replacement has got certain limitations and permutations. We'll talk about it later when somebody asks me about question, which is the question takes us that way. We'll answer that question, and along with that, we'll discuss some more points about THR. Now, coming to the complication, somebody asked me the question. Complications are not commonly seen. When we start something, we should not worry about complications all the time, because we see very less complications nowadays, because the technology of surgery and the pain medication, the anesthesia have advanced so much along with us what we do. The implants or the method of surgery have advanced so much. Complications are pretty less. There are complications which are immediate complications, which are the fat embolism, which can happen when we prepare the femoral socket, and infection, which is again immediately, because if you don't follow the proper asepsis, proper theater technique, unfortunately, very fortunately, we have the protocols very secured and very patient safety protocol in Apollo Hospital, so we don't have any infections or anything. Even fat embolism, we have certain techniques to avoid fat embolisms, because we follow certain steps where you can reduce the complication of fat embolism. That's one thing. Then if you don't really balance the muscles well, and you don't position the cup or a stem, as we know that hip replacement has got a cup part and the stem part. So we don't position the cup and the stem part properly, then there will be the variation in version, then the hip gets dislocated. Hip can also get dislocated in cases where your muscle strength is not good. the muscles are weak, then the post-op, immediate post-op, the patient may get dislocated. And other complications like anesthesia complications and all that stuff, uh, well, which are very rare nowadays. That's what I was just telling you. And one more thing is injuring the vessels and nerves around the hip joint, which will not happen nowadays. It can happen, but not in a near future we have seen, or near past we have seen.
Thank you, doctor. Another question. How long does it take to walk normally after a hip surgery?
Yes, it's a good question. Uh, See, as I mentioned in the initial introduction, that hip replacement can be done in any age group, except teenage and all that stuff, because you people get, the boys or younger children also get hip diseases which are known to happen in childhood, like Bothi's and slipped capital femoral epiphysis, or infection due to infection which is known as Tom Smith arthritis. All these things can be managed with other kind of surgeries, like rotating the normal neck of the boy and buying some time till he grows to teenage and his skeletal maturity takes place and he reaches about 20-25 years. That's where we do we do all these younger age group, we do a cementless hip replacement, whereas in an older age group, because younger age group the bone stock is very good, when we do a cementless implants, the cementless implants will hold properly into the bone. They get locked into the bone. Bone ingrows faster in younger people. Whereas in old age group people, we do something called cemented total hip replacement, which is again a very good implant. There is always a demand for the cementing technique, and give a proper cementing technique, do a proper cementing technique and proper pressurization for the acetabulum as well as the femur. You get a total whiteout cement interdigitation. Cemented hips are very good, but these things are done in the older age group where the bone stock is weak and they have osteoporosis, all that kind. So coming to the question, how fast we can walk normally after THR. So when you do a cemented THR, and the next day we make them walk full weight bearing. They walk as if nothing happened. If the pain permits, of course this pain definitely permits nowadays, because we are taking good pain care for the post-operative period. The most 80% of the pain is there in first and second day. That 80% of the pain is being controlled by epidural analgesia, which will take care of the pain completely. In such situations, patients walk very comfortably on the next day morning. Sometimes when we do THR in the morning, we make them walk, we make them at least stand on full weight bearing to just give him the confidence that he could walk on the same day. That also we do in certain young patients, or a patient who is chronologically good, and though patient is old but he's active, such patients we make them walk on the same day. Otherwise patient is, as the pain permits, he can walk with full weight bearing. Coming to the cementless hip replacement, where the titanium shell cup which is fixed into the acetabulum, which locks well. There are different mechanisms of locking, different companies make in a different manner, but the idea is to get them locked into the bone of the pelvis, that is the acetabular shell, and the stem into the femoral medullary canal. When we lock these stems properly, we can as well make them ambulatory by the next day morning. We can make them walk with the partial weight bearing or 20% weight bearing, but patient walks on the same day or the next day with 25 to 30% weight bearing, because cementless stem or cups in total, cementless hip replacement will take around 6 weeks for the bone ingrowth to happen into the metal implants. So till 6 weeks we may say, we may ask the patient to walk with partial weight bearing. In the Western world, they also make patients walk on the same day with full weight bearing, even in the even in the cementless hips. But in here, especially, I don't do that. Some people, my few of my colleagues do that, but it's, I feel this is a little risky. You're opening, putting the implant, and you don't want the patient to suffer again. So we are going a little safer, and we are not achieving anything by mobilizing the patient. So we the patient safety is first. So we follow the patient safety rules and goals.
Thank you, doctor. Next question. What are lifelong restrictions after hip surgery?
Yeah, after hip replacement, uh, we instruct the patient not to squat down, not to squat. That's the only restriction we have. And one more thing, he can walk as much as he can, as fast as he can, but he should not be running where is in a speed where his both the legs are in the air when he takes a forward step. So that fast we won't allow. Otherwise, he can continue to do any activity except squatting on the floor.
What is the time frame for blood clot after hip replacement?
See, you mean DVTs, deep vein thrombosis. I don't think if patient is ambulated well and encouraged to do his ankle toe movements and ankle pumping and quadriceps, static quadriceps exercises, then I don't think patient should not have any deep vein thrombosis. But the risk period will be varies from day 1 to 3 weeks.
When can you put full weight on legs after hip replacement?
Yeah, as just mentioned, that in the cemented hips, they can walk immediately with full weight bearing, and in cementless hips, it will take 6 weeks, 4 weeks to 6 weeks.
What muscles are weak after hip replacement?
Uh, Ideally, there are no muscles get weak when you do it in a right time. The patients, when patient walks with antalgic gait, uh, certain muscles he uses more of a hip flexors and then adductors, and then he walks. Then the abductors and the extensors will get weak. So it's a right time to, there is a right time to do surgery where you can protect the muscles from wasting or getting weak. But commonly, hip abductors, that's glutes, get weak because when we open, even external rotators muscles we open, but they initially get weak or painful, but they'll regain in a span of 3 to 4 weeks by physio.
What happens if you bend over
When?
after hip replacement?
Just answer that.
What happened if you bend over after hip replacement?
At the limit, he bends, nothing happens. He or she bends, nothing happens. But when patient sits on the cross leg, or patient gets operated knee over to the unaffected knee, the hip replacement the replaced hip may get dislocated.
Can men still have arthritis after hip replacement?
No, no. There's no, because we are replacing the total the hip with the total hip prosthesis. There won't be any arthritis again. But there are in this juncture, I would say there are different bearings in the joint. Like worldwide, there are metal on metal bearings, ceramic on ceramic bearings, and polyethylene on ceramic bearings, and polyethylene on metal head bearings. But all these have different wear rates. Wear rate is nothing but when you put a metal on metal head, how fast it wears the surfaces of the two, the ball and the socket wear. And when you put a metal cup and poly head or poly cup and the ceramic head, how much wear is there? How fast are the wear? But these are all now we have the maximum advantage of research which is done across the world, and we get the best products into India. And whatever the bearings which are being used worldwide, we are also using highly cross-linked and zirconium ceramics. Uh, there won't be any wear and tear if the patient is compliant and the patient follows the doctor's advice and he takes care of his muscle strength and physiotherapy. Wear rate should not be there and should not be causing any arthritis. But whereas coming to the bearings, uh, we are using ceramic on ceramic, we are using ceramic on poly cup. Sometimes we are using metal on poly. Out now, there's another system which is picking up very faster is dual mobility cup, where THR conventional THR has got single bearing, whereas dual mobility cup and prosthesis has got a double bearing, so which will internally uh, uh, helping the patient to reduce the wear rate. This is what is picking up in the whole world, and moreover, the trend was doing ceramic on ceramic, but uh, there are certain complications. There are certain breakage of ceramic liners, which are bad for the patient. So even the Western world is turning around and trying to shift over to uh, poly cup on ceramic head. I think that will be the future.
Thank you, doctor. Coming towards our audience question, is hip, is hip replacement surgery a daycare procedure?
Uh, it can be done. It can be done as a daycare procedure, provided patient doesn't have any comorbids, patient is fit and all that stuff. We can do, or if a patient has got a budget issue. But I personally prefer to do it and do it as a regular admission case. Or else, even if it is done at a daycare, as a daycare procedure, he should be shifted to a center where the patient can be taken care of with his routine monitoring and all that. So the next second level care.
What is the most frequent complications after a hip replacement?
I think I've answered that. It's a common thing is the dislocation. If you don't properly place the acetabular cup and the femoral stem, there will be a change in the version. There will be change in the offset. There are different kinds of offset. Like to have a perfect muscle balance, you need to uh, replace the hip with the proper vertical and horizontal offsets and proper version. This all can be avoided.
What are the three types of hip replacement?
I didn't get.
What are the types of hip replacement?
Hip replacements are as I mentioned in the initial discussion itself, like cemented and uncemented. These are the primary implants, the primary hip replacement implant. Then revision implants are also there. They are mostly uncemented.
Coming towards our last question, doctor, please tell our audience about the facilities provided at Apollo Hospitals, Jubilee Hills, Hyderabad.
See, Apollo Hospital is one of the state-of-art hospitals, and it's internationally very popular among Middle East countries, and also people come from African countries, and we also get people from other countries like Fiji Islands, and furthermore far away from they cross continents and come. Recently we have operated few patients from Fiji Islands. They are really doing well. They went very happy. I'm very happy to share that. A very young lady came with a hip infection. We had to treat her because they in their country they said the hip infection is controlled and they can do a THR. But when they came here, then I did a CT guided biopsy of the synovium and all that. There was some infection. Then we had to put her on some antibiotics for 6 weeks. Then we did recultures, we did blood cultures, and even joint aspirations. Then we did a THR after 8 weeks of antibiotic intake. Then she did well. post-operatively. Even during the surgery, we didn't find that, we could not find any signs of infection while doing the THR. We have sent cultures of capsule, part of capsule and part of synovium. There was no infection at all. And she did well. She went comfortably. Coming back to the hospital, uh, here the care of the patient, immediate post-op care or the intra-operative care, the anesthesia team, um, it's all like, very coordinated way of teamwork. Finally, the benefit goes to the patient, patient's comfort, patient safety, which we give utmost importance, especially me and my anesthesia team. They are doing a wonderful job. Um, uh, this hospital is one of the very reliable hospital, I would say. The last 25 years of my experience, I've not seen much of intra-op infections and other complications.
Dear viewers, we have come to the end of our session and hope we have covered all the aspects. If you still have more doubts, you can book appointment with Dr. Balavardhan Reddy and clarify your doubts. Thank you, Doctor, for educating our audience in today's session. Thank you for joining us. Stay tuned for more